interest of time, I guess, why don't we go ahead and get it started then. So welcome, everybody. I'm Bob Savage. I'm the CFO and Vice President of Drake Dental Lab. Thank you for taking the time today to get a brief overview of the InstaRisa protocol. Drake has been involved with them for close to a year right now, and are truly amazed by what this technology and this protocol brings to the table. We're fortunate tonight to have really the founders and the developers of the InstaRisa protocol, Dr. Art Morales, Dr. Jeff Bynum, Fernando Polanco, and Chan Perel. So welcome, guys. We appreciate you taking the time so close to the holidays to share a little bit about InstaRisa, what that protocol does for the clinical community as a whole. So I'll turn it over to you, and look forward to hearing what you have to say.
All right, awesome. Thank you, Bob. We appreciate the introduction and appreciate you getting us on this to showcase kind of what we do and how we do it. So let's just jump into it, because I know that it's the holiday time, and if you have significant others like my own, we got things that we got to do. So what I want to start with is discussing, what is InstaRisa and what makes us unique. Is that visible on your guys' screen? So just really briefly, give you guys a little bit of background. Our workflow, we feel, is truly revolutionary because it's a 3D facially driven digital workflow. And you'll get to see here very soon what we mean by 3D facially driven. It's 3D facially driven that has a 3D rendition that is both functional and aesthetically pleasing to the patient when they review it. So just really briefly, our journey, I have a private practice in Clovis, California. Tell you a little bit about myself, and then Dr. Bynum can introduce himself. And I was introduced to Fernando Polanco about 3.5 years ago, and we integrated the InstaRisa protocols in the early stages about 3.5 years ago. So we have an in-house dental lab here in Clovis, California, and a lot of the, actually all of the protocols and all the workflows were developed here within our practice. So I have an implant-based practice, but I am a general dentist. And so the digital workflows that you will see are not just for full arch all-on-X restorations, but for any type of restoration, whether it's crowns or veneers or full mouth reconstruction with overdentures or dentures. So thank you. With that, I will let Jeff introduce himself. That's Fernando.
Hey guys, my name is Jeff Bynum, and I am a general dentist as well. And I do just about all sorts of dentistry, from dentures. I even did a root canal the other day. I wasn't, I hadn't done one in a while, but hey, you got to do what you got to do. And just so you know, I am InstaRisa as well as the other guys, but I've chosen the Christmas theme because it's at the time of this recording, it was around Christmas time. But Dr. Morales and I both are clinical instructors at the Coys Center. I have been on the advisory board, just rolled off the advisory board at the Coys Center, and also the course facilitator for the biomechanics course. So in this presentation, you'll hear us talk about John Coys a lot because we appreciate John Coys, and he's done a lot for us as clinicians as well as human beings, taught us to be systematic in our approach, and to be able to do facially generated treatment planning and design, which is what you're going to see here. So this really brings all that home so that you can see the face in the treatment design and then build that into the patient's face so that you have no more cants and no more midline shifts. And of course, occlusion is a big deal as well. You'll see all that in this process.
All right, Fernando.
Hi everyone, my name is Fernando Polanco. I'm a dental technician here in Clovis, California. So I started my journey, I would say 9 years ago, and 9 years ago. But when I started really, becoming understanding much better was when I was introduced to exocad. And since then, exocad, for me, I would say exocad changed my career because it gave me a different way to see things in dentistry, in digital dentistry, to be able to, create do things differently, by utilizing such a software. And then almost 4 years ago, I met Dr. Mireles, and so we started talking, and then I started working for him, and since then, we started creating and putting our minds together, and starting creating very nice techniques to be able to make everything easier and possible for everybody, for our patients.
All right, thank you, Fernando. Chan?
Yeah, hello, everybody. My name is Chan Purewal. I help with the sales, marketing, and partnerships within InstaRisa. So really happy to be part of our partnership with Drake. We want to make sure that we help dentists really, make their prostheses faster, time in the chair quicker, and more cost effective. So we're really excited to work with Drake and to really share our ideas.
So the name, just briefly, the name came about because Fernando and I, we both speak Spanish, and we refer to this system as InstaSmile in-house, and that was trademarked. And so as a result, the Risa means to laugh, which means to smile. So we decided to go with InstaRisa. So, our company is really big on core values, and that's one of the reasons that we've selected to work with Drake Dental Lab, because we feel like they share a lot of these common values. And for us, faith comes first. And with faith, we have to respect and honor the other core values as a result. And one of the things that you'll see in our courses that we offer is we're brutally honest. We showcases the good and the bad. And we have learned through the teachings of John Coyce that there's a lot to learn from the things that don't go right. And so we're constantly pursuing excellence. But as a result, it's hard to balance our personal life and practice when we're doing that. So one of the things I want to ask you guys is just to be open-minded. When you're thinking about digital dentistry, you really have to have a different perspective. And just like this picture shows, it depends on who's looking at it and what they're looking for. You can be looking right at somebody, or the person in the photo is looking off to the side. And that's one of the things that really helped me with digital dentistry, is just keeping open-minded and realizing that there's so many, digital dentistry really allows us to pursue things in a different fashion that we're accustomed to in the analog world. So just to briefly give you some background, when Fernando came to my practice, he was 100% digital, and I was 100% analog, and with all the techniques that John Coyce taught us. And so there was some convincing that had to take place. And as a result of that convincing, we have digital workflows that are actually hybrid models where, part of it is analog and part of it is digital. Now, InstaRisa, the way that we do it now in office is completely digital. And so we digitize our patients. And but as a result of going through that learning curve, it really taught me that, hey, there is something special here, and we can't necessarily just shut our minds off to it, because digital dentistry is here, it's here to stay. And getting in on this early on has been really beneficial for me and my practice. So predictable dentistry is fun. Dentistry is what I realized. But with creating these workflows, one of the things that I realized is that after the fact is that when you have a predictable workflow, I really wanted to make sure that the hard cost was at a minimum. It could be very expensive to get into digital dentistry. And so with our business model, we wanted to try to keep the cost and the investment down. What I soon realized, though, is that there's a lot of other factors that are very advantageous when it comes to digital dentistry. One is that we minimize the amount of appointments from start to finish. And it doesn't matter if you're doing a denture. In fact, we have a denture protocol. It's literally digital dentures in 2 appointments. First appointment is record, second appointment, you're delivering the denture. Or you're doing an all-on X case, where you can have the patient in a final restoration, literally the final restoration, in little as 4 appointments. And then I also realized that the appointments were a lot shorter. And as a result, everybody involved with doing digital dentistry just becomes to like it that much more. And of course, profitability is there when you can shorten your chair time. So, Jeff?
Yeah, so when we start talking about digital dentistry, you have to understand that all of these things are predicated by the analog techniques from these individuals that you see that have started different aspects of dentistry and face bows and articulating systems. And you can see we did things dramatically different years ago. And now we've learned some newer techniques and been able to incorporate technology into here. John Coys has done a lot with the FaceBo systems to be able to simplify those, with the glasses to be able to get the facially generated designs to be able to happen easier, more efficiently. And of course, Christian Coachman with digital smile design. And then of course, Fernando then brought the facial scanner to the market. So now at this moment, we're able to have a three-dimensional facially generated treatment design. So we have the patient in our hands on our computer screen where we can diagnose, we can treatment plan, we can design in the face. Because without the face, really, you're relegated to doing just what you learned in dental school, which is working on a dentoform. So the laboratory can do some amazing things, make things look wonderful on the model, but does it translate into the patient's face? Doesn't really matter what it looks like in your hand on the model. It has to look great in the patient's face. And not only does it have to look great in the patient's face, unlike every other body part, it can't just look good and not function, or can't just function and not look good. It has to do both. So with the utilization of these newer techniques and technology, we're able to then have all of the facial features there for us in the design. As you can see on the screen, this is one of our patients that was digitized. And once they're digitized, then we're able to design directly in their mouth as if the patient were right there on the screen. And what you'll see as if they're right there in your office. But as you'll see, we're able to then utilize different facial positions as well, different lip positions. So we could design in a high smile, in a what we call a Duchenne position, or in a repose position, or any smile design that we wanted to, any position that we like, we could design within that, and we can click on and click off easily with this technology.
Yeah, so digitizing the patient is key, because when you don't digitize the patient, then what happens is, and this happened to me in my practice and in Jeff's practice, when we do it the analog method, right, things can go very, very smoothly from a surgical perspective, right? Here's a patient, and these are just photos that we got off of the internet. This patient is in need of, extraction of the full upper arch, and implants are placed. Everything looks fantastic. It's beautiful, but then you deliver this. And
so what was missing? Oh my gosh, you have to think about setting your patient up after you've done all of this treatment, set them up and look at that. And for me, if something like that happened to me, my heart would sink and I would feel sick to my stomach, and I would begin to try to find a way to explain to her how I could possibly make it better for her in a very short period of time. And so the missing link there was the face. Clearly, you can see the midline was off, the canting is off, and that's just a total disappointment at the end of the day.
And so that's the key, right? Surgically, when we talk to dentists that are doing this full arch type of dentistry, then one of the things they talk about is, hey, surgery is typically the easy part, for lack of a better term, but the challenging part is the restorations, right? Where the surgery can be done, phenomenally. The restoration looks great. It screws in passively. But then you set the patient up and you get this. And so we see this time and time again, even within our practice prior to, using facial scanning technology. These could easily be one of my cases where time and time again, the surgery goes well, but the restoration just doesn't look right. And then we're in a position where we have to kind of talk our way through it. And we have to tell the patient, hey, listen, you're only going to wear this for about 3 or 4 months. And then I promise you, it's going to look better in the final restoration. But what if we were able to give the patient a provisional that looks just as good as the final restoration?
Hey, Art, I have to tell this story because the story gets better every time that something new comes about. I took these slides just off of Facebook, randomly off of Facebook, and we would discuss this very thing in our courses. And so I would be very careful to say these aren't our cases, and we're not saying anything bad about them, except that, the face wasn't involved in the treatment. So the end result was, potentially disappointing. And had they had the face involved, then these things wouldn't have happened. So in the middle of the seminar, one of the participants raised his hand and he said, "That's my case." And so, of course, my heart sunk and I tried to find ways to backpedal out of it. And And he said, I'll tell you the whole story if you want to hear it at the break. So of course I had to hear it. So at the break, I went to him and told him, that I would take the case off of our presentation. And he said, no, I want you to leave it on. And the reason why I want you to leave it on is because I'm the surgeon. And this was the kind of thing that I had to do sometimes to be able to create something at the time of surgery, where now I understand what you guys are doing. I no longer have to do these things. So I want you to keep the case in here. And he said, I want you to use the entire case. I want you to show all of it so that the people that you're talking to can see that had they had this technology and this workflow before they started this case, they wouldn't have had to do all of these weird things that you see here just to make it work.
But all of us have done things like this that, obviously don't look right. And we try to fix it. We try to adjust it. We try to make it right when it comes to the final restoration. So I think my computer is frozen here. Of course it is. All right. Let's see. You guys can see my screen now, correct?
We still see the same slide though, yes.
Okay.
There we go.
Okay, here we go. So, one of the things that John mentioned at the symposium is when you know better but do not do better, you feel worse about yourself. And that was me. That was me when I was doing these full arch cases, where I just decided not to do them anymore because the whole conversion process was just a big problem. Now, one thing I want to make sure that we make clear is that the case that we just showed and some of the cases that we're showing are all on X cases. But keep in mind, Jeff and I are general dentists, and we use the facial scanner for every single patient that walks through the door. And the reason we do that is for, number one, showcase quality, but also we have workflows where we will utilize the facial scanner for cases that involve veneers, crown and bridge, overdentures, dentures. So the point is that if there's teeth involved, you have a purpose. There's a use to be able to utilize the facial scanner so that you can have a more predictable outcome.
Now, one of my favorite sayings is this technology and this workflow will work for anyone that has teeth or has the desire to have teeth. And so anyway, whether it's crown and bridge or veneers or all on X or dentures, anywhere in between, then this technology will allow you to go from two-dimensional analog type of a technique to 3 dimensions. Because as you can see, not to be divisive in any way, but we've discovered after painstaking research that the world is not flat. So now that we understand that we're in a 3-dimensional world, then of course we want to find a way to make our dentistry 3-dimensional as well, for the sake of the patient, for the sake of the doctor, for the sake of the laboratory, to make everything more efficient and to make everything more predictable and to be able to decrease our chair time and costs and appointments and all of the things that make our lives difficult. Digitizing the patient is the key.
Yeah, and so here's a photo of our facial scanner. It's handheld, and I'll get a closer view of it here in a second. But for those of you guys that are interested in diving into the digital workflow, these are 3 main components. You have acquisition. Acquisition is basically gathering the data. And for our particular workflow, there's only 2 pieces of equipment that's necessary. It's an intraoral scanner and a facial scanner. Now, if you wanted to do implant dentistry, you want to integrate the CBCT into the facial scan, then you can easily do that by aligning it all with the DICOM images. And then that data is aligned, it's all put together in a mesh. There's other terms that are used, such as marrying, and all that is married together, and then you create a design. And the type of files that we utilize can be utilized in any of the designing softwares that are out there, such as 3Shape and Exocad. Once you design your restoration, then you can either mill or print your restoration. So that's the entire digital dentistry workflow when it comes to digitizing your patient and creating restorations such as this. So the video that we showed earlier was this patient that was digitized. And so we digitized the patient and we designed the restoration. And then this particular case happens to be an all on X type of restoration where we did both arches in one appointment, and then the patient got these milled restorations delivered literally the next day within minutes. So Jeff.
So as mentioned, digitizing the patient is key. So you can see what happens once you digitize the patient. You can digitize them in different lip positions, in a Duchenne, in a natural, in a repose, and in a shush, if you like, to see the transition line of the lower, to see the transition line of the upper. Then you can really dig in deep and see tooth position as it's related to the face. You can see that the incisal edges are in the right position or the wrong position. You can see that the patient shows a lot of tissue or not, and you can see where you might plan it. So then once you get to that aspect and figure out where the teeth need to go in the face, then you can begin to plan your restoration, whether it's crowns, veneers, or dentures, or all on X, whatever it might be. And you can do that in the appropriate vertical, in the appropriate joint position. So you saw just a second ago, you could see that there was a leaf gauge inside this patient's mouth. And so that was setting the vertical into the joint position. So this patient was placed into CR and that bite was open to the desired vertical. And then our scanner acts as a bite scanner as well. We'll talk about that a little bit in a minute. And it's a very accurate bite scanner, much more accurate than an intraoral scanner bite. And so then once the laboratory is able to have that vertical in that joint position with the patient and the lip positions, everything all together, they have all of the data that they need to be able to design the case perfectly from an aesthetic point of view, but also as well as a functional perspective, because now this patient's in their hinge axis, they're in CR, and all the laboratory has to do is design those teeth in that position so that when the restorations are delivered, whatever they are, then they're delivered right into that exact position. So the amount of adjustment is extremely minimal, sometimes nothing at all.
Yeah, and as we mentioned, we're digitizing the patient, and our digital workflows are not just for the provisional or the prototype or transitional restoration, whatever you want to call it. It actually is an A to Z digital workflow. So in this particular example, it's an all on X type of restoration. And you can see that we're able to align the CBCT to the intraoral scan data, to the facial scan data. Everything is merged together. We design the restoration at the vertical that's set, and we deliver restorations. And so what's really cool is that for the first time, I'm able to tell a patient, hey, Mrs. Jones, do you like this smile? And they're able to see the wax up in their face. Now, I don't know about you guys, but in the past, I would have a wax up and I'd bring them in and I'd show them the wax up on the table on a Panadin articulator. And it was, yeah, they'd like it, but who can really tell what that's going to look like in their face?
Remember
so
when
now,
the wax was green and you had the green teeth and you tried to tell them how amazing it looked?
right?
Didn't
Yeah.
seem to buy it.
But even making that white wax didn't really kind of drive it home. Now, when I show them a 3D rendition of their face and what the smile is going to look like, and I can look them square in the eye and say, I guarantee you, right? That's not a disclaimer. I guarantee you, your smile is going to look just like this. That's powerful. That's really powerful. And so, and the reason we can say that is that we have a one-to-one mesh with our intraoral scanner, with our facial scanner, and with the CBCT. And we're able to design it accordingly. So if a patient wants to change something, no big deal, they can change it. But they're able to see what the smile is going to look like prior to going to treatment, which is pretty powerful. So as mentioned, we have digital workflows. We have a workflow that we teach. It's literally dentures in 2 appointments. It's as simple as patient comes in, we take records that first appointment, we mesh all those digital records together, we design and we mill or print dentures, and we deliver the dentures on the second appointment. And the reason that we're capable of doing that is that the facial scanner eliminates the need for a bite, it eliminates the need for a wax rim, it eliminates the need for a digital wax up, because what you design at the vertical, at the bite that you gathered, is what you're going to get. So
I think it's also important at this point to mention that this is not just something that we do. This is something that many of our doctors do on a regular, or all of our doctors do on a regular basis. They've been taught the technique, they have the technology available to them, and then they have a laboratory that understands how to pull it off. They've got a Drake Dental Lab that they could utilize to be able to create this. So when Dr. Morales talks about dentures in 2 appointments, that's not just at our office. And that could be at your office utilizing Drake Dental Lab. You have the patient in, you take the intake records on day one, send it to Drake, and Drake will then send you back a denture that then on the second appointment you can put in their mouth. So even far away, even from a distance, now with digital technology, you can do these things with a good lab that understands how the process works and has the technology themselves, and you could also pull it off.
Sorry about that, Jeff.
That's good.
So here's a video, so the way our workflow works, if you're using Drake Dental Lab for, let's just discuss an all-on-X type of restoration. All the records are gathered, they're sent to Drake. Drake designs the restoration, they get your approval, and then you go to surgery. Now, what's really unique about our system is that you can use the system with a guided system or a free-handed system. And what I mean by that is we're not locked into forcing dentists to use a guide. There's a lot of dentists out there when it comes to implant placement that choose to do things free-handed. So now it's possible. And so the freedom that InstaRisa brings is really unique, because now the dentist can decide how they're going to treat this patient. So once the implants are placed, we capture that data, which is basically two records, right? We're providing a record that shows us where the soft tissue is after surgery and the implant location. That data is sent to Drake. Drake will align that data to the restoration design that you approved, and then they will ship the restoration, the provisional, to you in 1 to 2 days, and you just screw it in. And these appointments are fast. I mean, here we actually recorded the entire delivery of a double arch, and the video is 18 minutes long. Now, I'm not going to make you watch the 18 minutes, but I'm going to kind of skim through here, and you'll see that the upper restoration goes in less than 5 minutes, because all we're doing is screwing it in. And the lower restoration goes in less than 5 minutes, and we're checking the occlusion for 2 minutes, and then we're covering access holes and the patient's done. So what's nice is that now the laboratory has the ability to control the intaglio surface. And so I like my intaglio surfaces to be convex with a little bit of pressure on the tissue. So as the patient is healing, that tissue is going to form accordingly. So here you'll see that the upper arch is in, and now we're moving over to the lower arch. There's the lower arch.
I think the other thing that's important to note at this point is there's no conversion in this entire process. So at the time of surgery, which in this case was the day before, then implant position is captured, and there's no prosthesis. So there's not one already made, and you don't have to drill holes into it and have to try to adapt it to your implant position. That's all done digitally in the laboratory. So all you have to do is pick up the implant position digitally, get it to Drake. Drake will fabricate the prosthesis and a prosthesis that just has tiny little access openings for the screws. So there's not big holes troughed out into it to weaken the restoration and make it look not as pretty as it could. And so then you get back a restoration that's in its best form, and all you have to do is screw it in place.
So you screw it in place, and here is the bite. You can see they just went in. I'm tightening my last screw. This is the first time the patient's going to bite down, and that's the occlusion. And this is all a result of our digital workflow. We opened this patient's vertical, and we were able to design the restoration at that vertical, and we captured that bite with our facial scanner. So with the facial scanner, it also acts as a bite scanner, and we're able to deliver these restorations over and over again with minimal occlusal adjustments.
And independent research suggests that our facial scanner as a bite scanner is the most accurate bite scanner on the market. That includes intraoral scanning and extraoral scanning.
So we just make the adjustments that take place are less than 2 minutes. Again, this is a double arch that we delivered in less than 18 minutes. And so for me, that's the most powerful part for me as a full arch implant dentist, is delivering restorations with minimal occlusal adjustments, right? So he's telling me exactly where the bite is off. And it literally takes 2 minutes to make this adjustment, and he seats in, and all I'm doing is just adjusting some of the inclines. As he comes into that bite with his envelope of function, he hits on the incline. That's what he's feeling.
And when we started discussing InstaRisa, we started discussing with people all on X restorations, double arches in particular, because we figured that if people understood that we could do this with very minimal adjustment, with perfect aesthetics and occlusion that's practically dead on, if we could do that with a double arch predictably every single time, then certainly we could do it with a 3-unit bridge. Certainly we could do it with a veneer case. Certainly we could do it with all of your restorative options. So as Dr. Morales mentioned, we utilize the facial scanner for every patient that comes in the door. And we use that data to be able to design the restorations in their face. So we talk about all on X restorations, but it's not just for all on X restorations, it's for the restorative dentist as well. And like I said, we just talk about this because we figure that if you get that you can do this with nothing to this in a day, then certainly you can do it when there's other teeth involved as well.
So his bite's good. And so one thing that we'll do is part of our digital workflow is that we will capture implant position at the time of surgery without photogrammetry. Now, with that being said, we are not here to talk negatively about photogrammetry. We know photogrammetry works. What we're here to say is that photogrammetry is not necessary when the digital workflow that we've created is utilized. And so from a financial perspective, that's huge, right? Because now we're eliminating the need for a $30,000 to $50,000 investment in a piece of equipment that captures implant position, right?
If, however, you have photogrammetry and want to utilize it, you like it, we understand it's accurate, it's good. And if you're enjoying that, then you could continue utilizing photogrammetry and use all of the facial data, because all photogrammetry does is pick up implant position. It does nothing else. It's a one-trick pony, picks up implant position. So if you want the facial data as well to be able to adapt your design to the face and have everything in the proper planes of their face, then a facial scanner digitizing the patient is going to be adjunctive at the very least, if not a replacement for.
Right. So, for proof of concept, what we do here at our practice is we take x-rays of every single arch that's delivered every time that we use this InstaRisa technique, where we're only using an intraoral scanner. So just to be clear, our facial scanner does not pick up implant position. We have a protocol that utilizes an intraoral scanner, which we'll show you here shortly, to capture implant position. And when we take these x-rays, we're just checking to confirm that the tie base is completely seated onto the multi-unit abutment. And as you can clearly see here, every one of these seats perfectly and passively, which is key with these full arch restorations. And again, this is the day after surgery where these restorations are delivered.
And of course, we do this for every single patient, every single time. So, and by the way, we do a lot of these cases live in our courses. We have live surgery. We don't make the participants watch the entire surgery, but the points where we're discussing certain aspects of our protocol, of the workflow, then we'll bring the participants into the operatory at that time, and then they can see those things. And so being able to watch aspects of the surgery, see it live, and then more importantly, to see the live delivery the next day gives an incredible amount of proof of concept. You're able to see how when the restorations come out of the box, the patient bites down, you can see the occlusal marks, and you can feel it for yourself if you like, and see that that the occlusion is dead on, that the aesthetics are dead on, and it's live, and there's 20, 30 people in the room, and they're able to see it every single time. It's amazing.
Yeah, it really is. And one of the things that's really key for us is this win-win-win-win concept. For the patient's perspective, they're getting a restoration that's monolithic, that's beautiful, and that has minimal adjustments when it comes to the occlusion or the smile line. And they're able to utilize this restoration for the 3-4 months of healing, or let's just say it's a denture. right? Everything is dead on. And those appointment times are a lot less. Now, if we're talking about all on X type of restoration, the surgical implant dentist wins because now they're able to place the implants knowing in advance that the restoration is going to fit, and it's going to be in the right place. And so we just had a conversation with an oral surgeon today, and one of the frustrations that he expressed was the fact that lots of times he'll get these cases from dentists, but they don't necessarily understand how to restore them. And so now when you have a design prior to going to surgery, everybody knows what the final restoration is going to look like. Now it's just a matter of following the steps that we teach. Now, from a laboratory's perspective, for them, the fact that they don't have to drive over and have their tech sit there all day long to wait their turn to do a conversion. So the restorative dentist wins because the restorative dentist doesn't necessarily have to pay a lab technician to come and do the conversion, right? In fact, we have dentists that now are just having their clinical partners do a lot of the scanning, and then they verify that the scan is accurate. And so they're completely eliminated from the entire process as a result of going digital. So this process really has a big impact on everybody involved when it comes to less chair time.
By the way, Dr. Morales, you were talking about different things that made it more efficient, particularly for the restorative dentist. Imagine no more face bow. I mean, there's absolutely no need for a face bow anymore because all of the facial data is right there. The point of the face bow was to orient the maxilla to the horizon. So from the patient's natural head posture or natural head position, depending on which article you're reading, then you can try to utilize that to be able to orient where the cant of the maxilla is. But now that the patient is digitized three-dimensionally and one-to-one, then if you've got a good laboratory like Drake Dental Lab, then they can do those things for you. So you're basically delegating the things that were maybe difficult for you, maybe technically not able to be delegated to your team. Now you can delegate that to the laboratory and they can do that all digitally for you. So it's certainly a win for the restorative dentist from that perspective.
Yeah, and as a restorative dentist, one of the things that I've seen immediately is now that we're providing the patient a monolithic restoration, then that restoration is lasting during the time of the healing phase. And that wasn't the case when I was doing conversions of any sort, whether it was a denture conversion or it was a prefabricated restoration that had holes in it that had to be retrofitted at the time of surgery. Those restorations had a much increased risk of cracking and breaking during the healing phase as compared to these monolithic restorations that are milled or printed and that fit very passively. So the advantages are huge for everybody involved. And one of the reasons that this is so appealing to many dentists is because the entry cost is a lot less when it comes to the digital technology and the need to the fact that you can eliminate the need for surgical guides if you choose to now for full arch restoration. So our scanner, here's a picture of it. It's a scanner that has the accuracy of 40 microns. So why is that important? Well, for the first time, you're able to scan the patient and their teeth with the facial scanner. That scan takes about 40 seconds. And then you can take the intraoral scan with any of the intraoral scanners that are out there, and you can align that data one-to-one. Now that that data is aligned without the need of fiducial markers or bite forks, that process is very fast and it's very effective. Now, what's unique about our facial scanner is it has three functions. It's a facial scanner, a bite scanner, and a benchtop scanner. So let me take you through that.
While you're here, I just want to note the software. These are screenshots, screenshots from our software. And I make mention of it because if you were to go to any of the other facial scanners that are able to be purchased in the world, you'll see that they were designed for something else entirely. So the user interface of our system is designed for dentistry and designed to be able to make this easy. We're always looking for easy button. We're looking for a way so that you can delegate this to your team and have it be accurate and predictable and successful every single time. So this software was designed specifically for this purpose, and this scanner, its settings and its specifications were designed specifically for dentistry and helps the entire team from your clinical partners to your laboratory technicians to be able to work with it easily, to be able to create the restorations that you need for your patients.
So Fernando, can you share a little bit about the tabletop scanning features?
Yes. So basically, our facial scanner, we utilize it since it's 40 microns accuracy. We are able to really get a very precise, scan. For example, for dentures, for bite scans, and facial scans at the same time. We also, we can utilize this facial scanner as a desktop scanner, which is, unknown on the dental field. Like, our facial scanner is not only a facial scanner, it's not like a facial scanner like other scanners on the market right now. With a facial scanner, you are able to really scan a denture and make a copy denture. If you want to, make a new denture, you can basically do it this way. And what I found out is like, it makes everything much faster because you have your facial scanner next to you, and then you can, take all these records right away. And, it makes everything much faster, much fun, and, and more very predictable.
Yeah, one of the things that Fernando just recently discovered is that it's much faster and even more accurate to scan, for instance, a denture with our facial scanner as compared to an intraoral scanner. And the main reason is that the field of view is much larger for the facial scanner. And that's why we utilize it as a bite scanner, right? We're taking an anterior bite scan at any vertical that you choose, and then we're aligning that data to the intraoral scan of the teeth that are captured with the facial scan bite scan. And then we just design our restoration accordingly. So one of the cool things is that when we're using this facial scanner, as I mentioned before, we're able to align it with a true one-to-one. And so this photo just depicts how aligning a scan truly shows the alignment of what it's like for a one-to-one ratio of the facial scanner and the intraoral scanner. Fernando, you want to elaborate here?
Yeah, so basically you can see on the pink one and the yellow one, these are this is a denture. The left one, it's basically from the 3D scanner, and the purple, it's from our 3.0 facial scanner. And we're able to really get this type of data from a facial scanner and be able to really scan dentures, like the bites and faces, and basically be able to merge or align or marry the scans together accurately. So we really digitize the patient 100% and be able to get very predictable results, and really tell the patient, hey, this what you see here on our screen, this is what you're gonna get. And and so we feel like our technology, with our technology, all this is possible.
Yeah, and one of the things that we're really big on at InstaRisa is constant research and development. Literally every case, Fernando is in the operatory with Jeff and I, and we're reviewing what we can do to make the workflow better. And so what InstaRisa is today is significantly different than what it was a year ago, and we're constantly enhancing. So here's just a sneak peek of our future scan bodies that we're actually prototyping at the moment. So I'll let Fernando just discuss this briefly.
Don't tell anyone, it's our secret.
Yeah, so basically, we're constantly trying to make things easier, right? Like fun and easier. And I want to say this, like, I just got a message saying like, hey, you're just copying the pig flags. And I said, no, I don't think so, because, we started testing, we are constantly researching and developing, for new, better ways to do things. And, we started using this, the system pick, the flags, and doing by testing and doing research and development. I noticed that I could use these flags in a different way, in a much better way, to really, be able to scan with an intraoral easier. And when I started testing these flags, I noticed that we can put them together and be able to really scan implant position faster, because now it's common sense that just put the intraoral scanner occlusally and we just follow that path. And by testing and doing research and development, now we're coming out with much better ways to do capture implant position, which is just with an intraoral scanner. And and it's very accurate, and it makes everything much faster and fun, and a lower cost as well.
So all of the things that you see there that are being displayed are things that are either in production, or we're working on, we're prototyping, or that are actually in the market at the moment. And they were all designed for this protocol specifically. They were designed to make the workflow more efficient and easier and more easy button, right? For just to use that term, because it makes sense. We wanted this to be able to be utilized by anybody that understands how to scan, that understands how to do, a scan of even a single tooth. We want them to be just as predictable with a full arch or a denture or any other process.
And then here, for example, I get these questions all the time. For example, what is the blue material for? That's all the questions that I get all the time. And the reason we developed this material is to really help the intraoral scanner to track in between scan bodies and be able to capture implant position accurately. Because an intraoral scanner, there's a lot of articles and studies that it's not possible with an intraoral to get passive fit every single time. So what we did is we developed the scanner material to really help the technology and see what's possible with this current technology. And we just needed to really help the technology to make this possible to capture implant position accurately.
So our facial scanner, it is mobile. We can move it from operatory to operatory. In my practice, we really highlight our technology and we scan every single new patient. And the reason we do that, it takes 20 or 30 seconds to scan. And some of the words that come out of their mouth is like, wow, that's amazing, right? And so instantaneously, the patient feels that they are at a practice that's different, that's unique, that's innovative, and that's going to be able to help them in a way that nobody else has. The other thing is that I delegate, right? The learning curve for this facial scanner is not steep. I mean, we teach this course in 2 days, and we allocate maybe an hour and a half to 2 hours of scanning during that course. And people leave the course thoroughly understanding how to use the facial scanner. And so being able to delegate this to your team members just automatically will increase your productivity in your practice. So this video is just showing the fact that when we take our intake records, it can literally take less than 5 minutes to capture all the records that are necessary, which is a bite record, the Duchenne smile, and the natural smile, and the repose. And so it's very quick, and that's one thing that's important for me. Now, these intraoral scanners have been tested and verified that they work with our particular scanning protocol to capture implant position. And so as a result, utilizing the 2 pieces of equipment that are necessary is our facial scanner. We do have an app, but for all intents and purposes, there's no comparison with the 3.0 facial scanner. And as I mentioned before, PIC is an option and Cam 3D is an option, but you have to understand that there's a large investment to get into this technology. By the time you add the need of an intraoral scanner with this technology, you're up to $60,000 to $100,000 for a piece of equipment that captures implant position, whereas ours does the things that we mentioned as a facial scanner, desktop scanner, and a bite scanner. So here are some of our scan bodies that we've utilized and we've created ourselves. So we have the digital libraries for these, and it allows us to capture the scan quickly in less than 2 minutes. As we showed earlier, you're able to scan the patient at the time of surgery in a bloody field with saliva. And you're able
to— As I mentioned, sorry, Art, I cut you off, but as I mentioned earlier, all of these materials and products were designed for this purpose. And so if you read the literature, Fernando alluded to it, that the literature states very clearly that you can't scan around the arch, particularly when there's an implant on either end and they're spanning greater than 16 to 22 millimeters apart. And in a bloody field, you just can't scan accurately around the arch. But if you read the articles, you can see that there's a pattern. The difficulties, the reasons why they're not able to scan around the arch and scan in a bloody field, that sort of thing, we have overcome with these materials, with this workflow. All of this entire system was designed with that in mind, to be able to overcome all the difficulties. So this is something that we do live in our courses. It's something that we do day to day in practice. And it's something that doctors do that have taken our courses, and they send us their cases and they show us their x-rays, and every single one of them say to us that it's amazing that they weren't able to do these things before, but because now they're following the system and have the technology, then they're able to do it efficiently and effectively and predictably.
So this video is depicting a case where it's a milled bar, right? And never in my wildest dreams in the past, doing it the analog method, would I imagine taking an impression and delivering a final restoration in your next appointment. Well, that's what we're doing digitally. So we capture implant position and we milled a final restoration, in this case, the titanium bar, and we deliver the restoration the next appointment. And we do that with confidence because of the workflow that we've created that allows us to capture implant position very precisely with an intraoral scanner. So there's different options. You know, if you want to outsource your restorations, you can outsource the entire process to Drake Dental. There's also an option if you have an in-house printer, then Drake will create the STL file, send you back the STL file for you to print or mill the provisional restoration in-house, and then they will fabricate the final restoration utilizing the same workflow that we discussed earlier. So with our All-on-X workflow, you're able to go from start to finish in as little as 3 appointments to get a provisional restoration, or if you choose a final restoration, or 5 appointments if you're going to skip the prototype once the implants have healed, or 6 appointments if you're going to integrate a prototype once the implants have healed. The point is that you're able to eliminate a significant amount of appointments for these All-on-X type of restorations from start to finish.
And a significant amount of money if you choose to not use some of the higher priced products to do that.
Yeah, so here's Joe. I'll just briefly take you through Joe. Joe was ready to make a big change in his life, and we made a drastic change. This is a case that we did live at one of our courses. You can see how we just digitized Joe, and we're able to give him the smile that he was hoping for in literally 2 appointments. So we digitize him. Fernando teaches CAD/CAM courses to anyone that's interested in learning these designing techniques that will really increase your time. I should say decrease your time and increase your proficiency when designing these type of restorations. And so we design it, we get the patient's approval, and then what we'll do is we can even place the patient in a virtual articulator to confirm that everything is looking nice in natural head position. And what we design is what the patient gets. And so what we'll do is at the time of surgery, we'll just merge that data to the pre-op design, and then we'll mill or print these restorations. I shouldn't say we as in me, but Drake will be able to provide those restorations to you. So once that's done, then it's just a matter of just screwing in the restorations the next day or the next, and within 48 hours. And this is the type of occlusion that we get time and time again. You can see the dots there. This is right out of the box, right? We screwed it in, we had the patient bite down. You can see this was the next day. So I beat him up a little bit, but this is what he looked like 4 months later. Those are the same restorations. And yes, that's the same person. It's just now he's not so small. It's him. So, but in this case, it was pretty extreme. You know, we were able to shorten his incisal edge 5 millimeters and move his teeth palatally 4 millimeters to give him the smile that he always dreamed of. So we're able to do this. You know, what's really cool is these patients now, they're smiling with confidence. They're putting up their photos on Facebook. This is now just to show that InstaRisa digital workflow with the face is not just for All-on-X. This is Valerie. She was prepared to get all her teeth removed. I convinced her otherwise and told her that we can save these teeth. These teeth are salvageable. And all we needed to do was restore. And so we actually ended up just extracting, I think, 4 teeth, and we did 1 implant bridge on the upper right. and we're able to digitize her. That's the first step. We digitize her. And she had this really large smile. And so she had a gummy smile. And so this is something we identified, and then we designed with an open vertical. You can see that's the bite scan. And then once we design at that vertical, we show the patient. And she wanted her teeth to be more display. Here was an immediate low temporary bridge on the upper right quadrant. We actually, this case is a hybrid case where I did significant amount of crown lengthening, and then we took a conventional impression, and then we align all that data. We align this data to the pre-op design that was designed with the face, and then we just print her restorations. And those are the printed prototypes. But you can see here that from the pre-op design to the final restoration design to the actual final restoration, it's a true one-to-one design.
Take a look at the pictures too. Just take a look at those pictures. You can see her pre-op design, her final restorations and design, and then the final restorations in her mouth. It looks exactly the same. And that's entirely the point, is it looks the same because it is the same. And so whatever you show her on the left side of the screen will show up in her mouth on the right side of the screen. And so everyone's happy.
Exactly. And so now we do these cases with confidence, and we're able to deliver these type of restorations in minimal amount of appointments predictably. And so that's her case. So just briefly, this is Ephraim. We have techniques that allow us to go from this to just digitizing the Ephraim. Same thing. Again, we're designing the restoration preoperatively. We're capturing implant position. Here's a picture of our scan bodies at the time of surgery. We place the ScanDAR material, which helps our intraoral scanners track. And this is us scanning again. And then we're able to capture the soft tissue with a putty impression that we scan. This is Ephraim the next day. That's what he looks like. Those are our healing abutments that we utilize that integrate with a library that integrates with our scan body. There's the lower arch 24 hours later. Here's his restorations, and then we screw it in. And this is what he looked like 6 weeks post-op. And that's the occlusion that we get. And that's Ephraim immediately after. So you can see the midline is right where it needs to be. The smile line goes where it's supposed to be. So again, we can show you guys case after case after case. The key is the digital workflow that integrates the face is essential for our workflow, and capturing implant position without the need of photogrammetry is an option for those that choose to utilize it. So
if you're utilizing our technology and our workflow, and you're utilizing a good lab like Drake Dental Lab, then you're going to be able to expect these results on your own. You're going to be able to expect to see that the midline is dead on, that there's no canting of the occlusion, and that the occlusion itself, the bite, is dead on with very minimal adjustment. That's the kind of thing that we expect when we utilize a lab like Drake and our technology and our workflow, and we expect that you should expect the very same thing and achieve the very same thing as well.
Well, fantastic. Thanks, Dr. Bynum. Thanks, Dr. Morales. Obviously, you touched on a lot tonight, but there's a lot more to talk about with this. It's been a fabulous protocol for us here at the lab, and our team here utilizes it each and every day with amazing results. So thank you. Up on the screen now, we have a course coming here in Charlotte on January 14th, just a few weeks away. Would invite anybody to please reach out and register for the course. It'll be an all-day event here at the laboratory here in Charlotte on a Friday. So invite everybody to go out to instarisa.com course calendar to register, or you certainly can call the lab here. For more information, you can ask for myself or Dan Soma, and we can certainly get you registered and get you involved with the course. But thanks so much for your time tonight. Obviously, around the holidays, it's always tough, but appreciate you taking the time just to talk about what an amazing protocol you guys have built in and around the All on X protocols, as well as just the general dentistry. It's truly amazing. So thank you so much.
Yeah, thank you, Bob. It's been a great pleasure to partner up with you at Drake and your team there. That are so innovative and just really take care of the dentists that we have referred to you. So thank you for being such a great partner. We're here to serve you and your dentist. So if there's anything else we can do to help make this more successful, by all means, just reach out. So thank you, everybody, for tonight and spending some time with us. If you have any further questions, just reach out to us. You can reach us at info@instarisa.com, or you can visit our website at www.instarisa.com. Thank you.
Thank you.
Great. Thank you, and happy holidays, everyone.
Okay.